Many people often feel surprised when a loved one passes away suddenly. However, according to medical research, most deaths have warning signs. 1 year before death, the human body often shows the following 6 important signs. 1. Underlying diseases are getting worse. As people age, many people suffer from underlying diseases such as high blood pressure, cardiovascular disease, cirrhosis, kidney failure, cancer, or chronic obstructive pulmonary disease. If these diseases are not well controlled, they will become a major barrier to longevity. Within 1 year before death, underlying diseases tend to get worse. The patient feels increasingly severe symptoms and is often hospitalized due to poor health. This is a notable sign that needs to be closely monitored. 2. Severely weakened immune system. Immunity is an important shield that helps protect the body from disease. When the immune system is weakened, the risk of infection increases, and even mild illnesses like the flu can become dangerous. A typical example is the case of Taiwanese actress Barbie Hsu, who died of the flu. Many people wonder why a seemingly simple disease can cause death. The main cause is a weakened physical condition and a very weak immune system. Elderly people, especially those with low resistance, are susceptible to the flu and quickly progress to severe pneumonia, requiring hospitalization or even death. 3. Rapid weight loss, prolonged loss of appetite. Unexplained weight loss and prolonged loss of appetite are signs that cannot be ignored. In folklore, there is a saying, "The lamp runs out of oil," referring to when the body no longer has enough energy, life is gradually exhausted. If a person becomes increasingly thinner, has poor nutrition, and is physically weak, then it is very likely that they are entering the final stages of life. 4. Decreased ability to move and take care of oneself. Life is closely linked to movement. When a person is no longer able to move, personal activities become difficult, then the quality of life will seriously decline. When a person gradually loses the ability to take care of himself, needs someone to support him in all daily activities, it is a sign that the body is clearly weakening. 5. Mental breakdown, prolonged fatigue. Deterioration in health is not only manifested in the physical, but also in the mental. Elderly people who are optimistic and love life often live longer. On the contrary, if a person becomes quiet, tired, no longer interested in surrounding activities, and is always in a lethargic state, it can be a warning sign that the remaining time to live is not much. 6. Sleeping more than usual. Getting enough sleep, 7 to 8 hours a day, is good for health, but sleeping too much can be a warning sign. As the body weakens, the patient often feels constantly tired and tends to sleep more than usual. In the final stages, they may fall into a state of lethargy and coma before dying. In recent years, we have heard many news about sudden deaths, such as a 30-year-old man suddenly fell to the ground while working overtime and eventually died. A young college student suddenly died in the dormitory after one night. Suddenly fell to the ground and died suddenly. Under the pressure of work, many people work tirelessly and often stay up late to work overtime, or medical staff work overnight and company employees work overtime until early morning. Then there are very tragic sudden deaths. That also reminds us that we must maintain a good life. What is sudden death? With the continuous increase of news about sudden deaths, it has become a strange and scary phrase. Many people have heard of sudden death, but the definition of sudden death is not very clear. Sudden death refers to unexpected death that occurs naturally. According to the standards set by the World Health Organization, it is defined as a non-traumatic, unpredictable accidental death occurring within 6 hours. Because sudden death mainly occurs within 1 hour after the onset of symptoms, sudden death is defined as artificial death occurring within 1 hour after the onset of the attack, and refers to the irreversible cessation of biological function. Coronary heart disease, severe arrhythmia, myocarditis, congenital heart disease, and other cardiovascular diseases can all cause sudden death. In addition, cerebrovascular disease can also cause sudden death. Among them, coronary heart disease is the main cause of sudden death, accounting for about 40% of deaths due to sudden cardiac arrest. Most cases of sudden death are usually caused by external reasons, such as staying up late, overwork, long-term smoking and drinking, and emotional excitement. There are also a few sudden deaths during sleep. These people will directly pass through the dying period, and then fall into a coma and die. Most patients with sudden death actually have some warning signs before the tragedy occurs. What are the warning signs of the body before sudden death? 1. Chest tightness. If you have no history of heart disease, but suddenly have chest tightness and the condition is relieved after resting, it is likely to be a precursor to the disease, and you need to be vigilant because atherosclerotic plaque rupture can cause acute myocardial infarction, and the mortality rate is also high. In addition, there has been chest tightness in the past, but the recent symptoms have worsened, which may also indicate a small damage to the plaque, and acute myocardial infarction may occur at any time. 3. Slow heart rate. The human heart's rhythm is initiated by pacemaker cells. As you age, the function of pacemaker cells will gradually decline. Especially for people over 80 years old, the heart rate tends to be slower than that of young people. If the heart rate is too slow, it will cause cardiac arrest and sudden death. Therefore, the elderly should regularly monitor their heart rate. If the heart rate is lower than 50 beats per minute and accompanied by a drop in blood pressure, you must be alert to the possibility of cardiac arrest. 4. Numbness. Numbness in the limbs is a common symptom of stroke, which can also cause sudden death. When symptoms such as numbness in the limbs, dark eyes, fatigue, unsteady walking, crooked eyes, etc., special attention should be paid to the occurrence of stroke, especially those with a history of hypertension and coronary heart disease. People pay more attention. 5. Digestive symptoms. Some patients with sudden cardiac death will have repeated gastrointestinal discomfort before death, but there is no history of stomach disease. At this time, it should be noted that this may be a sign of a heart attack. This symptom may be relieved after rest and will not last for a long time, but it will always recur in daily life. 5. Digestive symptoms. Some patients with sudden cardiac death will have repeated gastrointestinal discomfort before death, but there is no history of stomach disease. At this time, it should be noted that this may be a sign of a heart attack. This symptom may be relieved after rest and will not last for a long time, but it will always recur in daily life.